What is ozone therapy? Oxygen ozone therapy is a term that describes a number of different practices in which oxygen and ozone is administered to the body. Ozone has been shown to stimulate the immune system, increase blood circulation, and aid in the production of single oxygen species in the body. More oxygen leads to an improvement of the immune system, which then kills germs with the help of white blood cells. Defective cells or diseased cells are then removed and replaced. Oxidation naturally occurs in the human body, which is how our bodies fight off disease. What is rectal insufflation? Rectal insufflation is a procedure during which the user inserts a small amount of ozone gas into the rectum using a tube or catheter. The ozone gas is absorbed through the colon walls and then distributed into the blood, which is then carried throughout the body. Why is rectal insufflation the preferred method? Think of ozone as a form of medication. With that being said, there are two primary ways your body can take medication. First is through the mouth, and second is through the rectum. There's a huge difference when taking medication through the rectum. Medication can be delivered up to 4 times more efficiently through the rectum than through the mouth, making it the preferred method for ozone therapy. Your colon has a tremendous amount of blood vessels, including the portal vein, which runs directly from the intestine to the liver. The other advantage of doing rectal insufflation is that you bypass the lungs, which are sensitive to ozone. What do I need to know before doing a rectal insufflation? It is recommended you have your colon as clean as possible before you do a rectal insufflation. This can be done by doing an enema or having a bowel movement. Doing an enema before your rectal insufflation is recommended, but for some, a bowel movement will be sufficient. What is the best position for a rectal insufflation? Right side. This is the best position for doing a rectal insufflation. Lay down on your right side. Keep the right leg straight and bend the left knee towards your chest, knee resting on the floor. You can rest your head on a pillow or the right arm. Your left arm will be able to reach your anus easily in this position, making inserting the catheter and removing quite comfortable. This is not the only method, but the most common one used. Recommended settings and the proper way to do a rectal insufflation? The recommended settings for a rectal insufflation are a flow rate of 1/8 LPM and an ozone concentration between 20 and 40 micrograms per milliliter. To achieve this ozone concentration, set your oxygen flow to 1/8 of a liter per minute and adjust the ozone dial to the corresponding ozone concentration. See ozone gamma chart. The average amount of gas inserted into the rectum starts at 125 milliliters and can be increased to 300 milliliters of gas depending on the person. Milliliters is equal to cubic centimeters. At a flow rate of 1/8 of a liter per minute, the total amount of oxygen is 125 cc. You will need to use a lubricant to insert the catheter, such as olive oil or coconut oil. Option 1. Preferred method. Using a bag, set your oxygen and ozone to the desired setting. Once the ozone starts to exit the ozone generator, attach the insufflation bag to the ozone output of your ozone generator. You will then see the bag begin to fill. Once the bag is filled to the desired level, disconnect the bag from the ozone generator and clamp the tubing so the ozone is locked in the bag. Next, turn off your ozone and oxygen, and then attach the catheter to the insufflation bag. Set yourself in the correct position and insert the catheter 4 to 6 inches. Once the catheter is fully inserted, you will then roll the bag to squeeze out the ozone. Do this slowly. Once the bag is fully emptied, or if you feel bloated, pull out the catheter. You can now get up and move around, but try and hold the ozone gas for 20 minutes. Option 2. The direct method. Set your oxygen and ozone to the desired setting. Once the ozone starts to exit the ozone generator, attach the catheter with enough tubing to reach ozone out of the ozone generator and to be inserted into your rectum. Typically, you will need at the bare minimum 5 feet of tubing. After that, set yourself in the correct position and insert the catheter. Follow the same guidelines when filling the bag. If you feel full, pull the catheter out and remember to hold for 20 minutes. If you are using a flow rate of 1/8 LPM, the longest the insufflation should last is 2 to 3 minutes. For options 1 and 2, some people may need to use an ozone humidifier when doing a rectal insufflation. An ozone humidifier will attach moisture to the ozone, allowing it to be less irritating and less drying. This is not necessary for everyone, but if any irritation occurs, the user may want to consider adding. What to expect after the insufflation. After the insufflation, some people notice an urge to go to the bathroom or to release gas. This is completely normal and should not be a cause for alarm. Over time, your body will adjust and become more accustomed when doing rectal ozone insufflation. Cleanup. After you are done with your rectal ozone insufflation, you can then reuse the catheter or dispose of it. If you choose to reuse the catheter, rinse with water and soap until clean. After that, you can use hydrogen peroxide to rinse the catheter clean, followed with a water rinse. Once this is done, cleanup is complete. I hope this video helped, and please feel free to share and pass along to anyone that needs assistance with rectal insufflation. For more information about ozone therapy equipment, please visit promolife.com or give us a call at 888-742-3404 to speak with a qualified ozone therapy expert.